Hello all, hope you guys are doing well. Today is an auspicious day. Hope some of you have received the vaccine already. I'm waiting for my number to come. So today we have an interesting class lined up covering a very important topic of two subjects. If you guys can see me and hear me clearly, please give a thumbs up in the chat because I can see you guys on the chat box on YouTube. Just give me a few seconds to get started. Yes, I think you guys can see me now. Please give a thumbs up in the chat box so I know you can see me, you can see the presentation. Okay, great. Thank you, Akanksha. So while we are waiting, just let me give you a little idea of the class. This class will benefit both undergraduate students appearing for final MBBS as well as postgraduates, those who are appearing for NEET PG. NEET PG only 3 months away, and I'm sure a lot of undergraduates have their MBBS exams either next month or in March. In Maharashtra, it's next month. It's end of February. In other states, I'm sure it will be happening soon. These things, instruments in surgery and orthopedics, we never really focus too much on. Today's class is mainly about orthopedic instruments, thoda bahut surgery ka. Let me tell you, I am a surgeon, but still I have realized how important instruments in orthopedics are because I see students struggle left, right, center. The expectations from these topics are very minimalistic. Today's class, I will give you an idea of how to identify and what is the expected question. There are not many good books which give you much information. I have had to go through many books, online articles to get an aggregation of all these topics. Initial part will be general surgical instruments, not too many. Mainly we will do orthopedic instruments. Alright, many of you have joined in. So before I start, just let me tell you a little bit about myself. I am Dr. Amrit Nasta. I am a bariatric surgeon from Mumbai and I am your Unacademy educator. I stay in Mumbai. I am a bariatric surgeon. If you wish to learn more from me, please download the Unacademy Learning app. It's there on Android and iOS, and you can follow me. Please follow my profile. There are a lot of wonderful educators on the platform covering different subjects. You can definitely make good use of it. Those appearing for NEET PG. Some new batch courses are starting, which will help you prepare for NEET PG 2021 now that the dates are out, as well as NEET 2022. Let me tell you, there may be next exam in 2022. The announcement will come soon. So you have to be prepared for both the eventualities. You can use my referral code 10surgery, that will get you a 10% discount. And also remember guys, every other Sunday, so next will be 24th Jan, there is a quiz called Unacademy Combat. It's on second MBBS subjects, Pharmac, Patho, FMT and Anesthesia, and you know there are wonderful prizes. The last one was conducted last Sunday. So do join in for that. It's a live quiz. There will be 45 questions of all these subjects, and whoever comes first, second, third, they get different prizes. So do join in for that. Okay, I have already told you about the Plus subscription and Iconic subscription. Whatever exam you are targeting, take subscription that suits your time frame appropriately, and please remember to use my code. That is 10surgery. Now today's class, of course, instruments means image-based questions. Some will be MCQ patterns, some will be descriptive. I'll tell you the important points. How do you identify? What are the expected questions? What theory topics are relevant in those topics? And of course, some tips and tricks. जो books में नहीं है. How I know? Don't ask me how I know. Being a surgeon, I know a little bit about orthopedics. I have been reading a lot of it in the last few months. So I have tried to make life easy for my students. I realized orthopedics is really the Achilles heel, not just the theory topics but also the instruments and x-rays. So I'll give you the important pointers. Trust me, life will be very easy. At the end of today's class, you will say, give me any instrument from what we cover, you will be able to handle it. एटलीस्ट आइडेंटिफिकेशन तो हो ही जाएगा. एक दो सवाल ऊपर नीचे बोल दोगे, योर लाइफ विल बी सॉर्टेड. बिकॉज वी कांट स्टडी ऑर्थोपेडिक्स एंड सर्जरी एंड मेडिसिन एंड ऑब्स एंड गायनेक एंड पीड्स. हाउ मच डू वी स्टडी, राइट? देयर इज अ लिमिटेशन. Okay, there is a mix. Initial few questions are a mix of surgery and ortho, then we'll go to pure orthopedics. Okay, so let's see how you guys think. And please answer in chat box. I can see what you are writing, only I can't hear you. That is the limitation. So try to answer in the chat box. This instrument is used for, okay, we are starting with surgery plus ortho combined, okay, combined instruments. Yeah, this is used for skin incision, draining abscess, elevating the dura, or elevating the periosteum. Please understand, just because I am talking about ortho, first I am a surgeon, so don't jump the gun just because you saw, because let me tell you, this instrument could be a BP handle. I hope you know what a BP handle is. Could be. I didn't want to make your life that easy. It could be a BP handle. It could be a dura elevator. It could be something with which we drain abscess cavity or dig into the abscess cavity, or it could be periosteal elevator. So what is this instrument? They all look very similar. I'll show you the pictures also. Yeah, most of you have said periosteal elevator. Can you tell me why? I hope it's not been a guesswork. Can you tell me why are you calling this a periosteal elevator? I mean, what is so unique about it? Periosteal elevator. And can anybody tell me the full name of the instrument? So whenever they ask you, you have to give the full name, you have to give the material, what it is made up of, how it is sterilized, and then what are its uses. ऐसे इस pattern में answer करना होगा. Anybody knows the full name of this instrument? And then of course you'll have to tell why are you calling it a periosteal elevator. Yes, this is a periosteal elevator. Looked familiar with thumb rest. Okay, I will accept that, Sujay. So this thumb rest is very classical of a periosteal elevator. More important, look at the tip. The tip goes like this. It's fairly blunt. The tip is fairly blunt. So there is a thumb rest, but mind you, thumb rest is also seen in BP handle. I'll show you. It's also seen in BP handle, but the tip is blunt because periosteum you don't need to dig in too much. Tip is blunt. There is a thumb rest. Okay, and it's a fairly sturdy instrument. अभी sturdy तो मैं यहाँ नहीं बता सकता. That for that you have to hold the instrument, but it's a fairly sturdy instrument, not a very light instrument because you need precision. With a light instrument you'll go kach 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 and you'll tear all the periosteum. It's not a very light instrument. It's a little sturdy instrument. That is your periosteum elevator. This is your BP handle. This one, Bard-Parker handle, also called as Bard-Parker blade holder. एक ही बात है. Which means it is going to hold your blades. So I will put the blades or the knives at the tip over here like this, and then I'll do whatever surgery I have to do. So this is your BP handle. You look at BP handle. This also has serrations at the body for you to put the thumb on or for you to grip. So ऐसा नहीं है कि there is no thumb rest. And look at this. Look at the tip. Blunt tip. Blunt curved tip. It's not sharp, huh? Because I only have to elevate the periosteum. Anybody can tell me why I have to elevate the periosteum? See, क्या surgery है जिसमें मुझे periosteum elevate करना पड़ता है? Please understand. This is the bone like this. The bone is covered by a structure called periosteum. It's the covering of the bone. All bones have periosteum. So why do I have to elevate the periosteum? Or in which surgery do I have to elevate the periosteum? That is what the intent of the question is. Because you get this instrument, you will say, yeah, this is a periosteal elevator जिसका मुझे full name किसी ने बताया नहीं. Yeah, what is the full name? Whose periosteal elevator is this? It starts with an F. Faraboff. Faraboff. ये Faraboff के नाम पे काफी सारे ऑर्थोपेडिक इंस्ट्रूमेंट्स है. ये नाम याद रखना. Faraboff's periosteal elevator. Okay, NK has said I elevate it in amputation. Okay, I will accept it. So normally when I have to do an amputation, let's say I want to amputate over here at this level, I will lift the proximal periosteum a bit. थोड़ा मैं periosteum elevate करूँगा because the blood supply comes from the periosteum. So I will elevate the periosteum, which was say like this over here. I will elevate it a bit, then I'll cut the bone so that a little periosteum remains. In pure orthopedics, where do I elevate the periosteum? In pure orthopedics, yeah, ठीक है, amputation is not wrong. In pure orthopedics, where do I need to elevate the periosteum? I'll give you a clue. If there is a fracture, okay, periosteum also gets cut. gets torn. What is the role of periosteal elevation and this instrument? Yeah, anybody? Any fixation requires periosteal elevation? You have some idea about some fixations in orthopedics? Osteomyelitis surgery? No, not really, no. Osteomyelitis में periosteum खुद ही से elevated हो गया होता है. It's called subperiosteal reaction. It is seen in osteomyelitis anyways. I don't have to elevate it. It's already elevated. Yeah, anybody? There are almost 100 of you online. I'm sure somebody knows. Why am I elevating? Intramedullary nail, Akanksha, absolutely wrong. That's a disaster. Anjali Rai, intramedullary fixation, again disaster. I don't have to elevate. Gosh, no, absolutely not. Okay, so let's say the periosteum is like this. I'm happy I'm taking this class. Ring fixator, absolutely not. DC plating. What is DC? Suja, DC क्या होती है? DC. Okay, you're close to the answer. I will accept your answer. So whenever I have to put fixation with plates, plate fixation, plates and screws. Okay, plates and screws. उसमें मैं क्या करता हूँ? I lift the periosteum. Okay, I elevate the periosteum. Yeah, dynamic compression, I agree, but why dynamic compression? कोई भी plating में you are supposed to elevate the periosteum. So elevate the periosteum like this. Okay, then I put the plate, whichever plate I am intending to put. Okay, you said DC plate, there are many plates we are going to do. I put the plate, I put the screws. Okay, plates and screws, and then I put the periosteum back on top. So the plate goes subperiosteal. Alright, so in orthopedics, the role of periosteal elevation, the answer in the exam is going to be when I'm going to put the plate. Easy? Just remember this one. This is your dura elevator. Okay, this is your dura elevator. I don't have to tell you where am I going to use a dura elevator. If I'm doing cranial surgeries, if I'm doing SDH evacuation, lobectomies, removal of tumors, I open the cranium first. Okay, then there will be dura. Once I open the skull, there will be dura. I cut the dura. I elevate it with this device. It's a little bit like a spoon. Yeah, I don't think exam में पूछेंगे. It's a very core neurosurgical instrument. I elevate the dura like a flap, and then I go about doing my surgery. And after the surgery is done, I put the dura back and I suture it. So that is dura elevator. Dura elevator किसके नाम पे मुझे भी नहीं पता. Don't ask me. All right. Easy question, since the first question was a little bit of a googly. Many people said intramedullary nailing. After today, you will never say that. Intramedullary nailing. Easy question. Which of these blades is used for skin incision and laparotomy? Easy question. This is one of the easiest questions of the day. This is again core general surgery. Orthopedic के सवाल आएंगे. First, I want you to get a little warmed up because as of now, you guys are a little shaken, as I can see. For laparotomy, all of these are surgical blades, by the way. I am asking you which one will you use for laparotomy, for skin incision. Okay, when I cut the skin like this in laparotomy, कौन से blade से करता हूँ मैं? Vedant is saying 11 number blade. Vedant, no. Come on, Vedant. It's not 11 number. 11 number blade is also called stab knife. I'll show you all. Stab knife. 11 number blade is not for laparotomy. Answer is 21 number. 21 to 23. I will show you all. Okay. I will show you all the blades. This is 11 number blade. Just look at the angle. It's a very small blade. All of these blades, mind you, are put on that BP handle which I showed you earlier. Bart Parker handle. Okay. So, ये जो 11 number blade होती है, just look at the tip. It's such a sharp curved tip like this. This 11 number blade, also called stab knife, is used for incision and drainage of abscess cavities. So if there is an abscess and I want to puncture it, I will puncture it with this. If there is a hydrocele and I want to puncture it, remove the fluid and then do the sac eversion or whatever else I do, I will use this stab knife. So incision and drainage, hydrocele drainage. Mind you, hydrocele ka treatment is not drainage. Huh? You drain the hydrocele and then you evert the sac. Chapules. Bhul nahi gaye, I hope. That is stab knife. 15 number, it's a much smaller blade. It is curved. Okay, it's not very sharp. It's a much smaller blade. It is used for minor procedures. I asked over here laparotomy. Abdominal skin is very thick. I am not going to cut abdominal skin with 15 number blade. Okay, this is for minor procedures. Minor procedures यानी क्या? Lipoma excision, fibroadenoma excision, where I need to take small incisions, dissect, remove. There I will use this 15 number blade. 12 number blade has a very angulated tip. That's why it is used for cutting the sutures. Means when I have to remove the suture, once the wound has healed and I want to remove the suture, I put it underneath the knot and I cut the knot. तो मैं knot के नीचे जाता हूँ और knot cut करता हूँ. These are the bigger blades, 21, 22, 23. They are for skin incision. In most cases, like laparotomy, in most of the surgeries when I am going to cut the skin, I will use these. I don't need much precision. Where I need precision, I will use 15 number. Small surgery, small incision, but abdominal surgery, laparotomy, even laparoscopy surgeries where I take 1 centimeter incision, I will use 21, 22, 23 only. कोई ज़रूरत नहीं है छोटे blades से. 15 number minor procedures. Okay, let's see if anybody of you has seen this instrument. It's a very one of a kind instrument. It's one of a kind. What is this instrument used for? Retracting in with surgery, and of course I hope at least one of you can tell me the name of this instrument. I hope at least one of you can tell the name of this instrument. Oh, हो गई googly. Nobody is writing in chat. Akanksha, Kritika, Shruti, Vedant, Samarth, Sujay, Anveshi, Rutika. So many familiar names, so many of my former students. In what surgery is this instrument used? It's one of a kind. Trust me, if you can't identify this, the examiner will give you the look. And for those for NEET PG, if you can't identify this, your rank will have a nosedive. You know, it will rock bottom because 90% people, ऐसे मुझे लगा था, would be able to identify this. It's a retractor, but what is it going to retract? Oh, I should really lower the bar. 100 people are online. Only Sujay is saying abdominal viscera. Sujay, you can see the tips. It cannot be a visceral retractor. Come on. Such tips, it's like a cat paw. That's not going to retract the abdominal viscera. You retract the abdominal viscera, it will tear the viscera. Akanksha has been bold and brave. Akanksha, what abdominal laparotomy wound have you seen this for? Just look at the size of the... Okay. Kritika is saying skin flap. I'm so happy. Anybody for D? Nobody is gone for D. I got A, B, C. Anyone for D? THR surgery? If I'll tell you the name, then you will be able to give the answer. It's called Chandley's retractor. Where have you heard Chandley? Chandley. Where have you heard the name Chandley? Very famous name. Very, very, very famous name. Chandley. It's called Chandley's retractor. It is a superficial retractor or a soft tissue retractor. But what soft tissue is it retracting? My God. Chandley discovered the surgery. He is known as father of that surgery. Yeah, it is THR. Answer is THR. Yes, father of arthroplasty. Chandley was the one who discovered this surgery. THR. Total hip replacement. I hope nobody was wondering ये THR क्या है? THR is total hip replacement. For those of you who know me, they should have figured that I will go in a certain pattern. Right? First I'll start with blade, then knife, and then I'll go to retractors, and then I'll go to the core surgery. That's how you approach, right? You don't straight away do the surgery. That's why I started with blade. Periosteum elevator was just to confuse you with BP handle. First you need BP handle, then you need blade, then you will cut the skin, then you will retract the soft tissue. So this Chandley retractor is for soft tissue retraction. Over here you can see in total hip replacement. What is the advantage of using Chandley? Anybody can answer. Why is this recommended in THR? What is the advantage? If you want to call it entirely, what will you call it? Chandley's what retractor? Chandley's what retractor? Something retractor. I सॉफ्ट टिश्यू तो ठीक है, पर किस प्रकार का रिट्रैक्टर है? हैंड्स फ्री. वाओ, हैंड्स फ्री लाइक मोबाइल फोन. सेल्फ रिटेनिंग. थैंक यू. सेल्फ रिटेनिंग. यस, सेल्फ रिटेनिंग. Alright, there are self-retaining retractors in abdominal surgery also, जिसकी मैंने फोटो नहीं डाली है. Like there are self-retaining retractors, but I don't want to burden you with that because those are not commonly asked in your exam. This is a very standard retractor. You can see, okay, how much ever I want to retract, I will advance it, pull it more laterally. So this is Chandley's self-retaining retractor for THR. This I hope everybody can identify. This is a very one of a kind retractor. And this, ये मैंने स्पेशल क्लासेस में पहले भी पूछा है. Yes, thank you Kritika. This is Doyens, but you don't call it Doyens, you should call it Doyens abdominal wall retractor. Doyens abdominal wall retractor. Okay, it's a very bulky retractor. It will go throughout the abdominal wall, means skin, subcute muscles till the peritoneum. Pura ka pura it will retract. Okay, so it is a abdominal wall retractor. This is Devers, but don't call it just Dever. Call it Devers abdominal visceral retractor. Abdominal visceral retractor. Then the examiner will ask you which viscera do you retract with Devers. Yes, anybody? Where is Langenbach? I have not put the picture of Langenbach. Langenbach is right angle. ऐसे छोटी सी होती है. That is Langenbach. Yeah. Devers abdominal visceral retractor will retract what all? Okay, someone has said liver. Pratyush says liver. NEET PG 2021 says, okay, Pratyush says bladder. Yes, liver, bladder. Anything else? Anything else it will retract? Yeah, liver, खाली liver नहीं retract करेगा. If you are calling it abdominal visceral retractor, it should retract more things, right? Not just liver. और क्या? Liver. Can it retract stomach? Stomach, intestine. Okay. Can it retract spleen? If I'm doing a left-sided Cocker's incision, it's not Cocker, it's left subcostal. Can it retract the spleen? Okay, Abhineet says liver, spleen. Please remember, don't use it on spleen, not spleen. It's not used for spleen. This is an exception to the viscera because its tip is a little sharp. इसकी जो tip होती है, it's a little sharp. Okay, so it can traumatize the spleen. It won't traumatize the liver, but it can traumatize the spleen. So don't answer in the exam a retraction of spleen. Normally used for cholecystectomy surgeries, open cholecystectomy. Both of them can be used for open cholecystectomy. Then expect that your viva will go on cholecystectomy, open and laparoscopy. That will be the way in which you guide your examiner to ask you about gallbladder disease and cholecystectomy. So Doyens, abdominal wall retraction and laparotomy or cholecystectomy. Dever, retraction of liver or intestines for cholecystectomy. Easy? So far life is easy. Now life will get harder because now we'll go to core orthopedics. Yeah. I have not asked you the name of the instrument. I have asked you what is this instrument used for. Yeah. What is this instrument used for? I will try to make your life easy as is possible. Yeah. What is this instrument used for? Orthopedic है, मैंने बता दिया. अभी से सारे सवाल orthopedic ही है. So now you can brace yourself. If you don't know anything, please wait till the end. If you know anything, see how much you really know. What is this instrument used for? Reduction of fracture, holding the bone segment, holding the fixation plate, or holding the bone and the plate together. I hope my star students are not stunned. Those who have come, taken efforts to attend my classes regularly. Yes, please, anybody? I've gotten C and D so far. If I just ask you the name of the instrument, what will you call it? Just the name. Since most of you are answering C and D, can you tell me the name of the instrument? And what is the function of this? This thing that you see over here. Bone nibbler. Wow, वो तो option में ही नहीं डाला मैंने. Bone nibbler. आशुतोष. Bone plate holding forceps. Okay, very good. Sujay has used some very nice words. This instrument, yes, this instrument is called, I'll tell you what it is called. It's called a plate holding forceps. Whose plate holding forceps is this? Who? In whose name is this? किसका plate holding forceps है? और क्यों है plate holding forceps? And then what will be the answer? If you see this kind of a adjustment knob, नहीं scientist नहीं है. If you see this kind of an adjustment knob, I'll show you another instrument also. This kind of an adjustment knob, simply you can say AO, plate holding forceps. AO, it's a German name of a Swiss place, of a very big institute of orthopedicians, where they design a lot of instruments for fractures. Okay, so Sare, you must have read in orthopedic books, AO. Don't ask me the full form, थोड़ा complicated सा नाम है. That AO is the institute, I believe it's in Switzerland, where they design a lot of orthopedic instruments for fractures, joint problems, all those. So they are instrument designing institutes. Yeah, yeah, that's what Sujay is saying. You don't need to know the full form. Maaf kar do. So it is a plate holding forceps. That is correct. But it's not only going to hold the plate. How exactly is it going to hold, and how do you identify this? You look at the tip. The tip has two surfaces. One surface has serrations. Okay, the other surface, which you can't really make out, is non-serrated. This is the hallmark of the instrument. Or one surface will be soft, one surface will be hard. So one surface will be hard and one surface will be soft. The hard side obviously is going to hold the bone. The soft side is going to hold the plate. How does this really work? I'll show you. Look at this picture, the first one. This one. There is a fracture over here. Okay. Assume that the periosteum has been elevated. Assume. Kar diya maine, periosteum elevated. Now I have placed this plate across the fracture line. And then I'm going to place the screws. Now when I'm going to place the screws, obviously the plate can move. To keep the plate in place, I use this instrument, AO, plate holding forceps. But mind you, it's holding plate on one surface, on the other surface it is holding the bone. It looks like this. This here you can see better. One surface is serrated and one surface is unserrated. The serrated surface, the rough surface, is going to be on the bone side. The smooth surface is going to be on the plate, because I don't want to traumatize the plate. Plate is what will keep the fracture in place eventually. So to keep the plate in place, I use this AO, plate holding forceps. What are these? What are these instruments? ये अलग है दोनों, ये और ये अलग है. टिप देख लो. Don't be confused. ये अलग है और ये अलग है. Both are different. ये क्या instrument है? Pratyush is saying bone holding forceps. What is the use of bone holding forceps? Again, this you will call it as AO, bone holding forceps. This is AO, bone holding forceps. But bone holding, plate holding तो मैं समझ गया. Bone holding forceps क्यों चाहिए मुझे? क्या कर लूँगा मैं bone hold करके? I'll give you a clue. Should I use bone holding? Should I use plate holding? Should I use both? Which do I use first? Which do I use first? ऐसा है क्या, अगर मैं प्लेट लगाने वाला हूँ तो प्लेट होल्डिंग, और प्लेट नहीं लगाने वाला हूँ तो बोन होल्डिंग? Is it like that? Think. Identification is easy. I told you, bone holding, both ends will be serrated. You can see, very classical picture. Both ends are serrated or both ends are sharp. Means both ends will hold the bone. To maintain reduction, Mithali, to maintain reduction, I need plate holding, na? What do you mean by maintain reduction? मजा नहीं आया आंसर में. Better reduction and approximation. Okay, you're close. These are the ones which are used for open reduction. So I hold the bone and align it with bone holding forceps. Okay, थोड़ा बहुत अगर mal aligned है, before I put the plate, I align it with bone holding forceps. So first I will align it, keep it in place, then I'll put the plate, then put it in place with the plate holding. So I need both. First bone holding, so that the bones get aligned perfectly. Okay, this is all under vision, huh? All under vision. This is open reduction, not close reduction. This is surgical reduction. So I see it under vision, make sure both are aligned with the bone holding forceps. Once that is done, then I tell, okay, I'll use this plate. So I put the plate, then I hold it with plate holding forceps over here, and then I start putting the screws through these holes. I hope everybody has understood clearly the use of these instruments. Okay, absolutely clear, no doubt should be there after today about such simple things. Complicated things आने बाकी है, ये तो easy चीज़ें थी, ये तो piece of cake था, अब थोड़ी कठिनाई आएगी. Yes, the golden questions, the ones that fox us so much. And after today, in your life, you will never be foxed. What is this instrument? Chisel, gouge, osteotome, curette. My. Favorite question है ये. In fact, what they do, they keep 3-4 instruments, ये सारे नाम वाले एक साथ में, and then they'll tell you, ये क्या है बताओ, ये क्या है बताओ, ये क्या, and then you will wonder, are all chisels, are all gouges, कौन सा क्या है? Once you understand the fundamental, never a problem. And I'll give you a trick to remember. One side beveled, so chisel. Acha. One side bevel is not osteotome. This is not a gouge. Gouge also has bevel. Oh. A lot of people are answering who normally don't come for my classes, so I am happy. This is not a bone gouge or a curette. सब लोग chisel और osteotome में ये सारे same ही दिखते हैं. Chisel, gouge, osteotome, they are all very similar looking. What is common to the three instruments? Anybody? Chisel, gouge, osteotome. What is common? Or the tips are how you will differentiate. But how do you identify that it is one of these three instruments? Orthopedics can be interesting if you want it to be. It can be a game of memory and mugging if you want it to be. At least my students, I want you to mug as little as possible. Because you mug, tomorrow you will attend another class of another subject and you will forget. Tomorrow you will attend my surgery class, you will forget all this. Chisel, gouge, osteotome, curette. What is common to all of these three? Anybody? ऐसे मुझे लग रहा है जैसे तुम लोग MBBS स्टूडेंट्स ही नहीं हो. एटलीस्ट ऑर्थोपेडिक्स का कॉमन चीजें आनी चाहिए. Yes, anybody? What is common to these three? Chisel, gouge, osteotome. Like if I keep the three, एक के बाजू में एक, one thing is common to all three. What is that? The handle. The handle for all three is more or less the same. What do I mean by same? It means it has this knob over here. What is the role of this knob? What is the role of this knob over here? Yeah, knob किसके लिए? Because all of these three instruments are going to be used with a hammer. You know what a hammer is. The hammer will be struck over here. तो मैं हथौड़े से मारता हूँ, right? The hammer is going to be struck over here. So all of these three are going to go through the bone to break the bone or make the bone, but to hit with the hammer. So all of these three instruments, when you are given in the exam, please hold them with your left hand like this. Don't hold them like a surgical blade. Yeah, don't hold them like a surgical blade. Hold them with your left hand and hold them like this. And expect the examiner to ask you what should you hold in your right hand, and you should say, sir, give me a hammer or something like a hammer, which is going to be the next question. Alright, so you hathode se marna. I'm using it hathoda because is it really hammer that we use or is it something else? We were going to discuss. Anyways, coming back, they have the same handle. How are they different? And what is this instrument? This instrument is a chisel. Chisel is correct. The doubt normally is always between chisel and osteotome. Chisel ka tip is like this. Okay, this is how the tip of a chisel is. Please do not confuse this with a periosteal elevator. Periosteal elevator thumb grip, and the handle was not like this. Periosteal elevator को hammer नहीं करना पड़ता. Okay, उसमें ये handle नहीं होगा. अरे, it's not. There is no carpentry in this. There is all science. Don't worry. So this is a chisel because it has one edge which is sharp or one bevel tip. Osteotome cut tip is like this, double bevel. Okay, osteotome has a double bevel. And gooch looks nothing like these two. Honestly speaking, gooch cannot be confused. Gooch is like a cup. Okay, it's like a cup. I'll show you the picture. Gooch cannot really be confused with these two. Doubt comes between chisel and osteotome. So chisel is single bevel, one side is cutting. Osteotome, both sides are cutting. Anybody can tell me trick to remember what is chisel, what is osteotome? I found a trick recently, yesterday only. Otherwise, till yesterday, I was also confused. कैसे पता चलेगा? Because they look the same, and in the stress of the exam, you have to answer 300 MCQs. You are given a picture like this. Oh my God, stress! Or in the stress of your viva. Anyway, surgery viva went pathetic. Now you're in orthopedics. You have a hip case. You have never studied hip in your life, and the examiner is not asking you hip. He's asking you identify this instrument, and you're like, oh my God. Easy way to remember. Groove in goose to remove bone fragments. That's fine. Now, how do I know? Chisel has single blade or single bevel and osteotome is double bevel. ये कैसे पता चलेगा? I'll tell you the trick. Chisel is C. Single C means one cutting. One side is cutting. Osteotome means O. You break the O into two C's like this. So both ends are cutting. Yeah, Adinath Patil. So osteotome is O. You break the O, you have two C's, means you have two cutting edges. Chisel, single C, single edge cutting. That's how you will remember. Easy to remember. Right? Now you see over here, this is an osteotome ka edge. Alright? Double bevel. If you look from the top, this is how it looks. So, ऊपर से तो नहीं समझ में आएगा. But look at the handle, to hammer. Right? Look at the handle, it's to hammer. These also look very similar, but this is single bevel, this is double bevel. So this is chisel, this is osteotome. Side image से ही पता चलेगा. What is the role of chisel and osteotome? Where do I use chisel? Where do I use osteotome? Chisel is used when I want to remove a sliver of bone. Chisel is used to remove bony slivers or slice. Where do I have to remove slices of bone? थोड़ा extra bone है तो उसको निकालना है. वो कब होगा? When do I need chisel? Chisel out a bone or sharpen a bone. कहाँ होता है ये? Osteotome तो पता होगा. Osteotome means osteotomy. Everybody knows osteotomy, I am sure. French osteotomy, Salter's osteotomy, and Pemberton osteotomy सुना होगा ना? Powell's osteotomy नहीं सुना है तो गड़बड़ है. Yeah, where do I use chisel? Where I want to remove slivers of bone. This is used when I'm treating fractures where there is extra callus formation. So if there is extra callus that I want to remove, I will use a chisel just to sharpen or shapen the bone. Osteotome is used for osteotomies. Osteotomies means cut the bone, where I have to cut the bone. Where do I cut the bone? Let's say the person has a deformity. Anybody can tell me where is this French osteotomy done? For which deformity? French osteotomy. Undergraduate level question है. पावेल तो जाने दो. पावेल मैं कल के लिए छोड़ा हूँ. French osteotomy कहाँ पे करते हैं? Osteotomy means you cut the bone to remove a part. Gunstock, excellent, absolutely right. Great, great. Pratyush Shamak, excellent answer. It is done for supracondylar fracture humerus, where I have to correct the varus deformity. We have to correct the varus deformity. Varus यानी क्या? The bones are coming inwards. The joint are going out. Okay, the joints are going out and the bone is coming inside. Gun stock deformity. That is osteotomy. Corrective osteotomies. बहुत सारी जगहों पे करते हैं. If I do it for varus deformity for supracondylar fracture humerus, it is called French osteotomy. Okay. Osteotomy is of two types. Anybody can tell me the types of osteotomy? Types of osteotomy. दो टाइप की होते हैं osteotomy. And what is the French osteotomy type of? Yeah. While you think on it, harp on it. This is how a bone gouge looks. It's like a cup. These are two different bone gouges. It's like a cup. Yes, Rishabh is saying closed and open. What is the difference? Closed and open. What is closed osteotomy? What is open osteotomy? What is closed? What is open? Let's say the person has a gun stock deformity like this in the humerus. Okay, bone is going inwards. Joint is going out, bone is going in. What osteotomy do I do? Closed osteotomy or open osteotomy, which we called as French. In one osteotomy, what I do is it's angled like this. This is the angle. I want to open, right? I want to open. No, Rishabh, जो तुमने बोला वो उल्टा है. I want to open the angle. So what I do here is I remove a wedge of the bone, make it open, and then I fix it. Okay, I remove a wedge and I fix it. Where I only remove the wedge, it is called closed osteotomy. In some osteotomies, I remove the wedge, increase the angle, and put a bone graft. Open osteotomy, where the cut ends are left open. That is open osteotomy. इतना detail नहीं चाहिए अपने को, but just for information, if you are answering well in the exam, this is where the Viva will go. Open and closed osteotomies. This is your bone gouge. What is the role of bone gouge? Bone gouge is nothing like it's just a cup. Well, although I'm preparing for NEET UG, we have such fascinating things. Yes, you have many more fascinating things. Don't worry. बहुत fascinating है. Yeah. What is the role? Where do I use bone gouge? Again, it is used with a हथौड़ा. So कहाँ पे use करता हूँ मैं bone gouge? Yeah, bone gouge. Gouge is like a cup. Yeah. Where do I use the gouge? It is used to harvest bone graft. What is the common bone graft that I use, which I harvest with a gouge? So let's say I decide I want to put some bone graft. So this is the bone from where I want to take. I put the gouge, strike the hathoda, get the tissue out, get the bone out, collect it and put it. What is the preferred site for bone graft? Yeah, anybody? Preferred site? Iliac crest. You have to give a better answer than that, Rishabh. Pratyush is saying iliac crest. Iliac crest is correct, but there is a precise answer. It is PSIS. Posterior superior iliac spine. Why do we use iliac crest for bone graft? Why is it preferred? I am sure Sej Arora will have the answer. He is one of my star students who harasses me a lot, but is a star student nonetheless. Why iliac crest or PSIS? It's because it is a cancellous bone. Cancellous bone means good vascularity. Soft bone, wherever I put it, it will remain easily. Cortical bone, bone grafts don't work very well. Which cortical bone do I use for bone graft? Yeah, one step ahead. This is how you will lead the Viva. खाली गूंज पे तो अटकेगा नहीं, थोड़ा ग्राफ्टिंग पे जाएगा. तो क्या बोलोगे? Which cortical bone do I use for bone graft? Commonly. Commonly. अरे बोलो. Yeah, fibula. That was easy. Fibula. Right? Okay. Yes, this is what I was holding on to from before, I didn't want to commit to this. That's why I was calling hathoda. This instrument is called hammer, mallet, either. Means you can call it either of the two. or it depends on the assembly, means disassemble and then decide what it is going to be called. Yeah. What is this? Is it a hammer? Is it a mallet? Can you call it either interchangeably, or you disassemble it, break it down, see the parts, then decide what it is? Yeah, interesting. Then someone who messaged at the top, glorified carpenters. This is the clincher. I want to hear from that person. That is the clincher. Yeah, NEET PG 2021. Yeah. What is your answer on this? Hammer, mallet, either, depends on assembly. Okay. All right. This is a mallet. Okay, this is a mallet. Hammer is not something used by orthopedicians. Hammer is used by carpenters. It is misunderstood that what we use is a hammer. The technical name is a mallet. Okay, so it's always chisel and mallet, not chisel and hammer, or bone gouge and mallet. What's the difference? They are different, huh? Though they look the same, they are different. I'll tell you what a hammer is and what a mallet is and how are they different. And in your exam, you are not going to be given a hammer. Don't call it a hammer. If the examiner calls it a hammer, maybe he doesn't know the difference, so forget about it, then submit to it. But MCQ aaya, it's mallet. What is the difference between hammer and mallet? A mallet is entirely metal. A hammer that carpenters use, only the striking head is metal. Alright, the body or the handle is wooden. कभी carpenter को देख लो, most of them will have a hammer, should not have a mallet. In a mallet, the entire body is heavy. Everything is heavy, not just the head. Heavy body. Because even the frame is made of metal. This is going to be light. So in a hammer, only the head is metal and only the head is heavy. What is the reason for that? Hammer ka two sides are different. Acha, I don't know if the two sides are different or not universally, but this is how you'll identify. A mallet is a heavy instrument overall, not just the handle, not just the blade. The whole instrument is heavy because you don't want to overshoot. Okay, you want to be very restrained. If the handle is light and the blade is heavy, then you can overshoot. And if you overshoot, then your screw will go through the bone, through the other side, come out of the skin. That's not possible with a mallet. Because ये handle इतना heavy है कि तुम जोर से नहीं मार सकोगे. Okay, नहीं मार सकोगे. The whole device is heavy duty. Versus a hammer. Hammer क्या? You're putting in a wooden board. You overshoot क्या ही होगा? कुछ नहीं होगा. In a human, you're not going to do that. So, orthopedicians are not carpenters. The instruments are different. Okay, there are more different instruments. I will show you. You will be amazed. और भी instruments है जो अलग अलग है. These are easy instruments, very easy to identify anybody. What is this? Number one. What is this? Number two. These are very easy. They are used in general surgery also to some extent. They are very easy instruments. General surgery में भी use करते हैं. Like if I'm doing a thoracotomy, if I'm doing amputation, if I'm doing cervical rib excision. Yesterday we did thoracic outlet syndrome. Many of you were not there. Yeah. So this one is a bone nibbler. It's a bone nibbler. It will nibble the bone. Means जो थोड़ा extra edges या unrefined edges है, it will just refine the edges. Please understand. Look at the handle. No mallet. No mallet. Okay. It has double action. Cross action. So please don't look for a mallet in this. This you hold with your right hand only. This is a one-man instrument. So whatever are the unrefined edges of the bone, like let's say I'm doing an amputation. As a general surgeon, we have used this in amputation. So once I cut the bone with the Gillies saw, I hope you have seen Gillies saw. If the edges are unrefined, I want to freshen the edges, I will use a nibbler. Just to nibble out these chote extra protruding edges of the bone. Bone nibbler. This is a bone cutter. Alright. Also called a rib cutter. In general surgery, it is used to cut the ribs. Like if I'm doing a thoracotomy, Ivor Lewis for esophageal cancers. I have to cut the ribs. Please understand ना, thoracotomies में rib काटने पड़ते हैं. I cut the ribs with a rib cut. Alright, if I am excising a cervical rib, I'll cut it with a rib cutter. So that is the role of bone cutter, bone nibbler, rib cutters. Any doubt in any of these? I hope you are having some awareness of what is happening and some understanding, and I hope your life is becoming a little easy. I know it's tough, no doubt about it, but since you have taken the time and effort to come to my class, let's try to make it a little easy. So far, we approached the bone. We saw the fracture, now we have to treat the fracture. I will give you a very simple protocol that you can write, you can answer in a lot of questions on fracture treatment. I'll just give you a flow chart. Simple sa flow chart. Somebody has a fracture. What all things are you supposed to do? The first thing you are supposed to do in any fracture is reduce the fracture. Then they will ask you the question, in which fracture is reduction not required? Anybody? कौन सा fracture reduce नहीं करना पड़ता? The meaning of the word reduce is to realign. Okay, I have to realign the fracture. तो काफी बार fracture ऐसे होते हैं. The first step is I have to reduce the fracture or realign the fracture. Which fractures do not require reduction? Ribs, scapula, they don't require treatment only. I am saying which fractures that you are going to treat in orthopedics do not require reduction. Rib, scapula, clavicle, fine. I am saying in orthopedics. Rib fracture is general surgery. So first things first, you will reduce only those fractures which are displaced. There is a reason I am telling you this. Because if you read books like Maheshwari, they give you treatment differently, displaced and undisplaced. Okay, you have to understand why he splits into displaced and undisplaced. If it's undisplaced, you are obviously not going to do anything. First thing, reduce. Reduce means realign. Before we go ahead, anybody can tell me the meaning of the word orthopedics? Orthopedics. What is the meaning of this word? The subject that we are studying, orthopedics. इसका मतलब क्या है? What is the meaning of the word ortho? What is the meaning of the word pedics? If your examiner is frustrated and the people before you have made his life hell, then he will go to such basic things. Straight child, okay. Ortho means straighten. Straighten. Okay, straighten. And pedics means pediatrics or children. Basically, orthopedics was a branch devised to correct deformities in children. The original orthopedics started as that. Then it was carried forward to adults and fractures. Children had deformities, developmental dysplasia, CTV, displaced scapular, femoral, all those things. Originally it started as that. Whenever I am treating anything in orthopedics, the first thing I have to do, if it is displaced, I have to reduce. Principle of treatment. First I will reduce. After I have reduced it, aligned it, then I am going to immobilize it. Alright, this is the universe of orthopedics or traumatic orthopedics. Reduce it, align it, and immobilize it. There are many things that I do to immobilize it. Everything in orthopedics is tended to immobilization. Keep it in place so that it heals. Now, how do I immobilize? How do I keep things immobilized? I'll just give you a simple flow chart. Either it will be non-surgical or it will be surgical. Surgical immobilization seems a little absurd, isn't it? Non-surgical, sabko pata hai, you will use splint. The meaning of the word splint means immobilize. What splint do I use? I use POP splint. वो जो हम बोलते हैं ना, plaster लगाया, plaster. It's not plaster. Plaster is the material. What you are actually putting is a cast or a slab. Alright, those are immobilizers. Splint का मतलब होता है immobilize, don't let it move. Either I will use POP cast or POP slab, or I will use non-POP. POP is the material, plaster of Paris. Layman calls it plaster. Okay, you are a surgeon, you are not going to say plaster. You will say cast, or you will say slab, or you will say splint. They are types of splints. Then you have non-POP splints. होते हैं. Bowler Blonde splint, Thomas splint, they are non-POP. They are ready-made devices just to immobilize, or I can use devices which are called traction devices. Okay, I can use devices which are traction devices. Intent is what? Immobilize. Surgical immobilization, there are many ways of doing it, which we are going to discuss. Either I will immobilize it or keep it steady with the help of nailing or plating with screws, or just screws, or wires, or external devices, external fixator बोलते हैं, which we are going to discuss. Sometimes the reduction requires to be done surgically. So how we reduce, that will again be surgical or non-surgical. That is not the bone of contention here. The bone of contention here is these nails plates that I am putting after reduction. मतलब पहले मुझे fracture realign करना है. Align होने के बाद keep it realigned, keep it in place. For that I use these nails, plates, screws, wires and other devices. Okay, think of orthopedic fracture treatment on these fronts. Okay, वरना जिंदगी भर splint traction का ही difference समझ में नहीं आएगा. There are two things in traction. One is a traction for immobilization and one is a traction maneuver. I don't want to go into the maneuver here. We are talking about traction device. I'll show you one traction device. बहुत सारे tractions होते हैं. But this is the whole gist of treatment. Okay. Now you have to assume that you have reduced the fracture. Reduced means aligned the fracture. Now things are in place. Now you want to prevent it from getting displaced. These are the devices that we are going to use. So for long bone fractures, I use one of these devices. Anybody can tell me what are these devices? ये common instruments हैं. Identification के लिए भी और viva के लिए भी. What is this first one? What is the first device that we see here? Intramedullary nail. It has to be answered better than that. It is not just intramedullary nail. It is called a K nail. It's called a K nail. What does the K mean? K stands for concher. Tough orthopedic examiners will ask you spelling. Concher. Okay. अगर वो थोड़ा संकी है तो पूछेगा. What is K nail? K nail is concher nail. What are these nails? ये कौन से nail है? You can even see it in the picture. What nails are these? And Suja, you have to spell it correctly. Yeah? It's not concher, it's concher. Okay, Rishabh is calling these nails, the second group, as interlocking nails. Very good. Yes, you are right, Rishabh. They are interlocking nails, no doubt about it. Now, what are these nails? First, I will tell you a little bit about how am I going to introduce them. Just understand how am I going to introduce them. So let's say the person had a fracture shaft of femur. They are used for fractures of long bone shafts. Normally shafts. Normally, yeah. Long bones. यानी टिबिया फिबुला में नहीं, टिबिया फीमर अपर लिम्ब में rarely humerus radius ulna. Radius ulna में भी कर सकते हैं. They are used for fracture long bones. Usually shafts, not metaphyseal fractures. Usually not. How do I introduce them? So let's say I have a fracture femoral shaft. Okay, इधर से टूट गया. यहाँ पे टूटा हुआ है. First thing what I did, I got it together. Either it was surgical or non-surgical. Either ways, I bring it together. Surgical reduction can be open reduction or close reduction. Either I'll reduce it closed. Closed means don't open the operative site. No operative site is opened. The hematoma that is formed remains where it is. That is close reduction. Please understand, close does not mean non-operative. Huh? Close does not mean non-operative. Closed simply means the hematoma remains where it is. Open reduction means I open the hematoma and then align it. That is open reduction. But they are not synonymous as non-operative operative. ऐसा नहीं है. Okay. So I have reduced the fracture. Now I want to keep it in place, keep it immobilized, keep it aligned. So what I do is I can take either of these nails. Okay, this is the skin on the thigh. Okay, this is the skin on the thigh. I cut the skin on the thigh, cut the subcute, identify the greater trochanter, drill a hole through the greater trochanter till I reach the medullary cavity. And then once I have reached the medullary cavity, I pass one of these nails through the skin, through the medullary cavity, through the medulla of the proximal part, through the fracture site, into the distal part, all along. Okay, and it goes all the way in. A very small part remains out of the trochanter. Very small part. थोड़ा सा part remains out of trochanter. थोड़ा सा. Why do I leave some part out of the trochanter? Yeah, ये picture में वो part capture नहीं हुआ है. थोड़ा part मैं trochanter के बाहर क्यों रखता हूँ? Little bit. Yeah. Yes, yes. Controlled reduction. Reduction is already over. To remove nail later. Excellent. To remove nail later. That helps you understand why do all these intramedullary nails have these eyes. All the nails have an eye at the tip or near the tip. Alright, near the tip. This eye has to be outside. This much part has to be outside. So that if I want to remove, there are devices like a hook which I will put through this hole and pull it out. After how much time am I allowed to remove the nail? If I remove the nail, after how much time can I remove the nail? What is the time limit? Yeah, time limit. If I put the nail today, can I remove the nail after 1 month? 1 महीने बाद निकाल सकता हूँ. फ्रैक्चर हील हो गया होगा. Yeah, anybody? A year? Oh, you're asking me. Don't ask me. Tell me. All implants for fractures, if they are going to be removed, will be removed after 2 years. Okay, after 2 years. Removing it earlier, there is a risk because remodeling keeps going on. Is it flexible? How does it bend? No, I'm coming to that. The flexibility part I'm coming to. Now, this is the basic premise of using a nail. Please understand, nailing does not mean open reduction. Nailing means intramedullary after reduction was done. I am not disturbing the hematoma. Hematoma remains where it is. So, how will this fracture heal with the help of the nail? How will the fracture heal? Will it heal with callus formation or without callus formation? When I put the nail, will the healing be with callus or without callus? और secondary intention, primary intention? ये थोड़ा background knowledge होना चाहिए orthopedics में, वरना बहुत गड़बड़ है. I cannot teach you fracture healing at this stage. Akanksha is saying without callus. Akanksha, why? Why without callus? My dear, if the hematoma is not drained, it will be with callus formation. Yeah, the hematoma is not drained. So please understand, these nails do not affect hematoma. So the nails will heal with callus formation or with secondary intention. Okay, this is the principle of how I use a nail. Now what are these nails? Little bit. The K nail or the Kanshar nail, as you can see very clearly, support, immobilize. It is having a typical shape. The shape is like this. It's a hollow nail. It's not through and through. It's a hollow nail. This nail on cross section is clover leaf. This is how you identify. K nail will have one eye at the top and cross section it will be clover leaf. It's a straight nail. Is the femur a straight bone? Is femur straight? Is femur a straight bone? And because someone asked, is it flexible? How does it bend? How does it bend? Exactly, it doesn't bend. So the femur is curved, it's not straight. The shape of the femur is a little C-shaped. Okay, femur is shaped like this. Alright, but the nail is straight. So what am I doing with this first generation nail, K nail? I am putting a straight nail into a curved bone, right, across the fracture, which means it is in contact over here, it is in contact over here, and it is in contact over here. What is this called? What is this called? Putting a straight nail in a curved bone means what? How am I fixing the nail in the bone? And mind you, this nail does not bend, na? ये bend नहीं होगा. Yes, yes. I've put a straight nail. It will be in contact with the femur here, over here, and over here. What is that called? 3-point contact. Excellent. It's called 3-point fixation. Excellent. 3-point fixation. The older generation nails, like the K nail for femur. Similarly, you have a V nail also. जैसे ये K nail होती है, वैसे V nail भी होती है. V nail is in tibia. What does V stand for in V nail? Yeah, what does V stand for in V nail? Like K is for concher, V is for what? Wow, come on, Mithali. 3-point fixation, yes. What does the V stand for in V nail? I'll give you a clue. There is no name after V. It's not named. The V in the V nail stands again for the cross section. The V nail in cross section will be shaped like a V. Alright, students who get confused, they say K nail is because the shape is K. The shape is not K. K nail is concha. It is shaped clover leaf. Okay. V nail is V shaped. V nail for tibia. आज के ज़माने में they are not used. So they work on the principle of 3-point fixation. Because you are putting a straight nail in a curved one. So it will be in contact at 3 points. What is the problem with the K nail? 3-point fixation. में problem क्या है? अच्छा बोला तो है. Why do I need these nails which Rishabh labeled as interlocking nails? Why do I need them? What's the problem with these K nails? When you look at this picture, you will get an idea. What is the problem? No rotational stability. Yes, understand, a nail is in the medullary cavity and it is across 2 fracture sites. Okay, it is across 2 fracture sites. There isn't going to be any rotational stability. It is going to continue to move. Okay, it is going to continue to move. There is no rotational stability, which is why these nails are now not used commonly. They are cheap nails, but they are not used commonly because there is no rotational stability, which is why आज के ज़माने में to get this rotational stability, you are going to use interlocking nails. Now, what are interlocking nails? Interlocking nails, very easy. If I am putting an interlocking nail in the femur, the nail is not going to be straight. The nail is going to have the curve of the femur. So it will be curved if it's going to be put in the femur. It has these slots for putting the screws. So when the nail is put, like I'll show it over here, it will be a curved nail. It will be kept in place with the help of screws. They are not really screws. They are something else. Screw is a misnomer. Something else is used. I'll tell you what it is. They are called bolts. Screw or bolt में फर्क होता है, but then you will say glorified carpenters. That's why you can call it screws. But the interlocking part is basically to put screws so that it remains in place. Alright, and you get rotational stability because with the screw in the nail, the bone is not going to move. फिर वो नहीं घूमेगा, कहीं नहीं जाएगा. Which is why interlocking nails, like this curved one is going to go in the curved bone, so this is going to go in the femur. The straight one will go into the straight bone, that is tibia, because they don't need 3-point fixation. Their fixation is with the help of the screws or the bolts. Okay, like this. The screws are keeping the nail in place. But for a curved bone, curved nail, for a straight bone, straight nail, how you will differentiate? It will have many slots for putting the bolts versus a K nail which will have only one eye just to remove it. In which first and foremost, nails or intramedullary nailing, I told you, just to summarize, are going to be used in fracture shaft of long bones. And if they ask you which long bones, preferably lower limb. Preferably lower limb. In upper limb, as a dictum, I'll just give you the dictum. In upper limb, normally we don't use nails. कर सकते हैं, करने को कर सकते हैं, but normally in upper limb we don't use nails. Nails are preferred in lower limb because they are load sharing. Okay, they don't take the weight, they share the weight. When this person will stand, some weight will go through the nail across the fracture site and some weight will be borne by the fracture site. So when the fracture site will bear the weight, it will come together. What is that called? When the fracture site comes together, when the person bears the weight, fracture will get what? When he bears the weight? Little bit. Yes, yes. Starts with the C. Excellent. Compression. Absolutely right. Compression. When there is compression, healing will be better. In upper limb, there is not going to be compression, है ना? Unless he is doing push-ups. Compress नहीं होगा. So nails are not preferred. In upper limb, I want a more graded compression, a more stable compression for the fractures to unite. That's why we use plates. I'll show you how they are different from nails. Nails are weight sharing. So in which fracture shaft long bone is intramedullary nailing not possible? Last question for this topic. In which fracture of shaft of long bone, I'm talking about anatomical types. So you know the different anatomical types of fracture. There is a transverse fracture, then there is a oblique fracture, then there is a completely displaced fracture, then there is a comminuted fracture. ओके ये 3-4 प्रकार के फ्रैक्चर्स होते हैं एनाटॉमिकल टाइप्स. इनमें से किस में नेलिंग नहीं कर सकते, जहां पर मुझे प्लेट या स्क्रू या वायर लगाना ही पड़ेगा? Once you understand these fundamentals, trust me, even if you become an orthopedician, your life will be easy. Just understand these fundas. In which of these is nailing not going to be possible? Comminuted, absolutely right, excellent. I can sense that you have understood the fundamentals because all are giving the correct answer. In comminuted, there are so many fragments. Nail cannot go through all the fragments. So even though it's a shaft fracture, टुकड़े टुकड़े हो गए, मैं एक नेल कैसे डालूंगा? एंड 2-3 नेल नहीं जा सकते हैं, एक ही नेल जा सकता है एक बोन में से. सो डोंट ट्राई टू पुट मेनी नेल्स, यू विल मेस अप द बोन. बाकी कोई भी टाइप का फ्रैक्चर हो, कितना भी डिस्प्लेस्ड हो, प्लीज अंडरस्टैंड डिस्प्लेसमेंट तो मुझे वैसे भी करेक्ट करना ही है बिफोर आई पुट द नेल. सो हाउएवर डिस्प्लेस्ड इट इज, फर्स्ट आई एम गोइंग टू ब्रिंग इट इन प्लेस, align it. Ortho, first bring it in place, then put the nail. Multiple fragmented fractures, can't put a nail. Alright, यही सवाल आएंगे nails के ऊपर. इसके अलावा they can ask you complications of nail. तो complications of nail are same. Nail can become loose, nail can affect the vascularity, nail can get infected, तो वगैरह वगैरह standard things. When will you remove? Not before 2 years. Okay, not before 2 years. And K nail जो आजकल यूज नहीं करते हैं, they ask you what should be the orientation of the K nail. ये जो slot होती है उसकी, the slot should be along the greater trochanter or the slot should be anterolateral. This I am telling for those appearing for NEET PG. जो clover leaf की जो ये slot होती है, the slot should be directed anterolaterally. Okay, that helps in better suitability of the fracture. It will stabilize the fracture better. It should be along the tensile area of the bone. That's why it should be anterolateral in femur. Okay. Right. Plates and screws. Uh, First you will just take the screws. You can see the screws look like your standard screws. There are two types of screws that are used in orthopedics. This is the first group and this is the second group. The same screws can be used with the plates also, mind you, but these screws are not used with nail, not with the interlocking nail. जो इंटरलॉकिंग नेल है उसमें ये स्क्रू नहीं होते, उसमें बोल्ट होते, बोल्ट. Okay, so don't say these screws I can use with plates, I can use over fractures, or I can use it in interlocking nail. वैसा नहीं है, वो नेल अलग होते हैं क्योंकि उनके थ्रेड्स अलग होते हैं. Anyways, so these are the two types of screws. These screws which have big gaps between the threads, they are called cancellous screws. Okay, they are called cancellous screws. These screws which have very closely placed threads, ये जो तुमको curves दिख रहे हैं, rotation जा रहे हैं screw के, which define the screw, these threads are very closely spaced. They are called cortical screws. Now you will ask me, sir, अगर हमको एक ही screw थमा दिया, एक ही screw दिया और बोला identify cortical या cancellous, difficult to identify. Honestly, difficult to identify. Only thing is, cancellous screws, not all of them are completely threaded. ये जो दो है, if you see, they have thread only over here. They are partially threaded. If they give you anything which is partially threaded, you can call it cancellous screw. That means the examiner is trying to help you. Okay, that means the examiner is trying to help you. Cortical screws by and large are completely threaded. But अगर एक ही screw दिया तो थोड़ा difficult है to differentiate the two. I'll tell you the difference, but difficult to identify. So cancellous screws. Cancellous screws, what are the parts of a screw? You have a head. This is called the head of a screw. Then you have the shaft. Then you have the tip, head, shaft, tip. And these things are called the threads. The rotations, they are called the threads. Anybody can tell me the meaning of the word pitch? What is the pitch? What is pitch of a screw? Yeah, what is the pitch? So pitch is nothing but the gap between the threads. Okay, they are the gap between the threads. So if they ask you, how do you differentiate cortical screw from cancellous screw, you will say, in cancellous screw, high pitch. In cortical screw, low pitch, because the threads are very close. There are more differences, but this is the main one. Other differences are hypothetical, मतलब वो तुमको दिखेगा नहीं. Like in a cancellous screw, understand a screw is like this. Okay, this is the body of the screw, and these are the threads which go on the outside. ऐसे जाते threads. So basically, every screw has two diameters. There is a diameter of the body, inner diameter, and there is an outer diameter which is the diameter of the thread. In a cortical screw, the inner diameter and the thread diameter is almost the same. The gap is not much. In a cancellous screw, the inner diameter is very little and the outer diameter is a lot. Okay, the threads are very bigger, much bigger. Okay, and they are much wider. The gaps are more. But ये तुम identification में नहीं बोल सकोगे, उसके लिए दोनों screws देखने पड़ेंगे. Not possible. Simply put, for identification, these are the differences. The pitch. If they give you both the screws together, then you can easily make out. किसमें gap कम है, वो cortical है, किसमें gap ज़्यादा है, वो cancellous है. Then the next question will be, where do we use these screws? Yeah, anybody? Where do I use cancellous screws? Where do I use cortical screws? Yeah, where do I use cancellous? Where do I use cortical? Yeah, cancellous screw where? Cortical screw where? Mind you, they can be used by themselves also. जरूरी नहीं है कि plate लगानी है. Yes, Cancellous where? Cortical where? Cancellous screws will be used where there is fracture of cancellous bone. यानी क्या? Fracture of cancellous bone यानी क्या? Fracture at epiphysis. Fracture at metaphysis. Life is easy, I hope. I hope your life after attending my class has not become more miserable. You may be feeling miserable, but your life will become easy. Cortical screws will be used over fractures at diaphysis. So easy. Diaphysis is cortex, epiphysis, metaphysis is cancellous, so that's where you use. What are these? What is being done here? What is the first picture and what is the second picture? What is the pathology in the first picture? Classical X-ray, absolutely classical X-ray. In our next class, we are going to discuss this disease when we do a little more. Yeah, classical X-ray. What is the first X-ray and what is done? Fracture neck of femur. So you should not call it neck of femur. The fracture line is over here, no doubt. Don't call it neck of femur. Call it intracapsular fracture of neck of femur. Intracapsular fracture. Because neck of femur के दो fracture होते हैं. एक intracapsular होता है और एक extracapsular, also called as trochanteric. उसको trochanteric भी बोलते हैं, intertrochanteric. This is intracapsular fracture neck of femur. Neck of femur means it is again going to be metaphyseal bone. So what have I fixed it with? I have fixed it with partially threaded cancellous screws. No, not proximal femoral nail. This is not a femoral nail, my dear. This is a screw. Partially threaded cancellous screw. What is the advantage of partially threaded cancellous screw over a fully threaded cancellous screw? Anybody? What is the advantage of using a partially threaded over a fully threaded cancellous screw? Gosh, you understand these things, na? You will be able to teach orthopedicians orthopedics. Controlled collapse, dynamic compression. Wow, dynamic compression. That's a very dangerous term you have used. Mitali is saying dynamic compression. Okay. Yes, anybody? What is the difference or what is the advantage of using a partially threaded screw versus a fully threaded cancellous screw? Control collapse or dynamic compression or what? Means I could have used this screw also. I could have used this screw also. Why did I pick this one? Why not this one? How are they different? Brings fragments together. Okay, very good. So I'll tell you. Very easy. Very easy. It's all based on principle of fracture treatment. एक ही principle है. मुझे क्या करना है? There is going to be some gap between the fragments. Okay, there is going to be some gap between the fragments. Now what I have to do, when I have to pass the screw, the screw has to bridge and the screw has to get the parts together. Okay, it has to bridge, bring the parts together and keep them together. There are two possibilities. There are two screws I can use. One screw is a fully threaded screw. Now when I use a fully threaded screw, I start drilling it from here. Okay, I start drilling it and then it goes across. Now what happens? Once the screw has gone across to the other side, that means there are threads in this part and threads in the other part. Both parts have threads. If there is a gap that is left in between, whatever I do, it will not come together. Okay, because the threads have kept it secure. So if a gap remains between the proximal part and the distal part with the threads inside, then I cannot bring the two together because अभी thread हो गया. एक बार thread चला गया through the bone, then the bone is not going to move. On the other hand, if I use a partially threaded screw, partially threaded means some part is straight and some part is threaded. अब क्या होगा? Once the threads come into the distal fragment gets fixed to the screw. But in the proximal fragment, when there are no threads, the bone can still slide. Okay, the bone can still slide. So when the head of the screw comes here and I keep pushing the screw more and more in, it will push the bone more and more in, and the two fragments will come together. That is the advantage of using a partially threaded screw. This part, which is non-threaded, which is in the other fragment, as the screw will be driven forward, it will have the ability to push the bone forward because there are no threads there. So now the bone is not stuck to the screw. It will allow better compression. What is the name of this principle of screw fixation? Anybody? What is the name of this principle of screw fixation using a partially threaded screw? What type of screw fixation is this? Where the non-threaded part is pushing the, yes, excellent, lag screw, amazing, excellent Mitali. It's called a lag screw because the non-threaded part is lagging behind. The bone is lagging behind, but because it is unthreaded, that means it's not fixed to the bone. It will allow me to push the bone more inside. ये bone नहीं हिलेगा क्योंकि इसमें तो screw के threads आ गए, पर ये bone आगे जाएगा. Better compression. Alright, this is lag screw where I use, there are other ways of getting lag screw effect. This is lag screw effect. One of the ways is using a partially threaded cancellous screw. Just some exam questions. What is a cannulated screw? What is a non-cannulated screw? Anybody? These are your exam questions. Plates we will do tomorrow. Tomorrow also I have kept a class part 2 orthopedics where we will do plates, we will do wires, and we will do external fixators, and we will discuss neck of femur. And of course implants. So before I can't jump to plates, but what is a cannulated screw? What is a non-cannulated screw? I mean, what is the advantage of a cannulated and a non-cannulated screw? Which one is preferred? So cannulated means through the body there is an open space, an open cylinder through the body like this. It's hollow inside. That is a cannulated screw. Alright, means there is a gap inside. So what can I do? Understand, when I am passing the screw, I am passing it, just through the bone with Siam guidance. क्या हो सकता है कभी कभी क्या हो सकता है, ये मेरा fracture है. When I am putting the screw, no, hollow screw is cannulated. Cannula means a gap, na? Cannula means gap. When I am putting the screw, it's possible that the screw goes in the wrong direction. Okay, it's possible. It can go in the wrong direction. If it's gone in the wrong direction, I cannot remove it. It has threads. If I remove it, it will damage the bone more. I don't want that. So what I do is, when I'm actually putting these screws, what I do is, I don't straight away put the screw. First I put some guide wire, like a K wire. First I put the guide wire. On top of that, once I'm sure it is in the right place, then I put the screw on top of it. And then remove the guide wire. Means what I am doing, in simple words, I railroad the screw. I railroad it. So first I put the guide wire across the fracture site. Once I am sure I have gone in the correct direction, uski upar I put the screw. Okay, and then I remove the guide wire. That is the advantage of cannulated screws. What are self-tapping and non-self-tapping? What are self-tapping? What are non-self-tapping? Yeah, anybody? Yeah, what are self-tapping and what are non-self-tapping screws? I'll show you the picture. Yeah, just look at this. A normal screw has a standard tip like this. A self-tapping screw has a grooved tip, grooved and sharp tip. It's grooved and it's sharp. Self-tapping means what? I can directly screw into the bone. A standard screw cannot be directly put into the bone. First I have to create a pathway. Like how carpenters, drill the hole in the wall first, then they put the screw. Similarly, with a standard screw, first I have to make a drill. Okay, there are devices which make the drill. They are called bone taps. First I have to make the pathway, then I have to put the screw. Self tapping means I can directly put the screw. So screws are permanent. They can be removed once the fracture is healed. Implants can of course be removed, but after 2 years. After 2 years, not before that. So these are standard and self tapping. Self tapping means you can directly put it inside. You don't have to create a hole before. Locking and non-locking I won't do today. It's a very important topic. Last part, what is the difference between an orthopedic screw? This one is for the guy who asked glorified orthopedics, carpenters, and a non-orthopedic screw. Don't tell me that a orthopedic screw is sterile and non-orthopedic need not be sterile. If I give you two screws, one from the wall and one from a person, how do you identify whether it can go in the person or not? Yes. Last question. Difference between orthopedic and non-orthopedic screw. Material तो मैं बता दूंगा. Obviously materials are excellent, Mithali. I hope you got it from here. Orthopedic screws, the head have a hexagonal shape. Alright, the head is always going to be hexagonal. That's how you will identify. If your examiner is, a little over smart, वो दीवार से स्क्रू निकाल के भी रख देगा तुम्हारे टेबल में और बोलेगा ये कौन सी स्क्रू है, यू विल स्टार्ट सर दिस इज कैंसरलेस स्क्रू, गैप्स बिटवीन द थ्रेड्स, इट इज कैन्युलेटेड, blah blah blah, it is made of stainless steel, blah blah blah. He'll say, doctor, I removed it from the wall. Oops. That's what will happen. When you get a screw, the first thing you will say is this is an orthopedic screw. First you will say this is an orthopedic screw, then you will talk about the head, you will talk about the shaft, you will talk about the tips, you will say the threads, either they are closely spaced or far apart, implying cancellous versus cortical screw, whether it's partially threaded or completely threaded, whether it's self-tapping or non-self-tapping. This is how you are going to describe the screw, and based on that you will tell the use. Okay, the material of most orthopedic devices, most, not just the screw, most, even nails for that matter, is either stainless steel or titanium. Okay, और तीसरा होता है कोबाल्ट बेस्ड. अपने लिए स्टेनलेस स्टील एंड टाइटेनियम. हमारे जनरल सर्जरी इंस्ट्रूमेंट्स आर आल्सो स्टेनलेस स्टील. All those hemostats, needle holders, they are all stainless steel. What's better? Is there any difference? Which one will you prefer? If I have to put a screw in myself, should I, if I'm giving the option, stainless steel ले लो या titanium ले लो, कलर में फर्क होता है आइडेंटिफिकेशन के लिए. Titanium screws have a different color. Stainless steel. Which one is better, or both are the same? Is there any advantage? I'll give you one clue. Titanium screws are more expensive. They are more expensive. Which one is better, or are both the same? Sujay is saying titanium. Why? पैसा ज़्यादा है तो अच्छी है, ऐसा नहीं है. There is nothing like more money so better outcome. Is there a difference between stainless steel screws, titanium screws, stainless steel plates, titanium plates, stainless steel nails, titanium nails? Why are these two options there? So titanium devices or titanium implants, we will call them implants. There are many advantages. The most important, no biofilm formation. Excellent Sujay, क्या आंसर दिया है तुमने, खुश कर दिया मुझे. So they are more resistant to corrosion. They have better tensile strength. Okay, they have better, they don't get eroded, they don't come out, they are, yes, okay, lighter, and they are MRI resistant, which means if I have titanium implants, I can undergo MRI. If I have stainless steel, it's a problem. One of the contraindication for MRI is implants, stainless steel implants. Titanium implants are not magnetic, so they are resistant. Alright, so we'll stop here. I'm keeping another class tomorrow at 11 in the morning where we will continue with the rest of the orthopedics. Do join me for that as well. So we are going to do the types of plates, we are going to do pins and wires, and we are going to do arthroplasty devices, bipolar, unipolar, all those things, and try to do a little bit of neck of femur. Alright, So hope you guys enjoyed this class. Many of you came. I am surprised. Normally I don't have 115 attendance. So I'm happy many have come. Do join again tomorrow. If any of you joined the class late, please go through this. And as always, please give a thumbs up in the end in the section when the class is done. Alright. So thank you for joining me guys. Take care and I hope to see you